morning, everybody. Firstly, can I thank the people of New South Wales for coming forward and getting tested. We had our record day in the last 24 hours to 8 p.m. More than 38,000 people came forward to get tested. So thank you so much to everybody who did that. Thank you to our Northern Beaches community and all of those in Greater Sydney who respected the health orders and the new restrictions we've put in place. And they are, at this point in time, having their desired effect. I'm pleased to say overnight we had 15 locally acquired cases, all of which are linked to the Avalon cluster. And obviously our continued hard effort is required to make sure that we continue that downward trend. But as we know, in a pandemic, things can be very volatile and can move very quickly. But pleasingly overnight, we did see a reduction in the previous day's numbers. So we've seen 15 community transmission overnight, all of which are directly linked to the Avalon cluster. But as Dr. Chant will highlight, there are still a number of venues where people who are infected attended outside of the Northern Beaches, and health always takes a very cautious and precautionary approach. So you will see during the course of the morning, as you've already seen for those of you who are monitoring the website, the government website, and we are encouraging people to monitor the website as much as possible, that you will see more venues added to that list as the day goes by, and that's because our contact tracers are doing a phenomenal job in getting on top of people who've been identified as positive and making sure they identify all those venues that have been to. To date, every single case we've had has been linked to the Avalon cluster, and that's the way we want to keep it. Although obviously some venues outside of the Northern Beaches have been impacted, and obviously they're issues that health officials are going through today. Can I also say, and Minister Hazzard will highlight this point, we do have, I believe, one of the best, if not the best, contact tracing team on the planet. But they can't contact trace people if they don't have the details. And Minister Hazzard will outline how important it is for businesses and organisations to give us those details, to make sure the QR codes and everything else is in place, because you can't contact people whose details you don't have. And I plead to everybody who runs a business, who runs an organisation, you should not be letting anybody in your front door, anywhere in New South Wales for that matter, unless you have your systems in place. You shouldn't be opening your doors as a business or an organisation unless you have your systems in place to get all the information for people walking through that front door. Again, can I thank everybody for respecting the restrictions. The government is monitoring the situation almost on an hourly basis. We will consider our position in relation to what Christmas and the next few days look like beyond Wednesday midnight on Wednesday morning, but obviously it's an ongoing brief. And again, I thank people for coming forward and getting tested. I thank people for respecting the health orders and the restrictions. It's evident that people are doing what we've asked them to do. And in terms of mask wearing, please make sure, if you're in an indoor setting, obviously on the Northern Beaches it's more paramount, but if you're catching public transport, you need to be wearing a mask. If you're going grocery shopping or indoor shopping in a mall or anywhere else, you need to be wearing a mask. In those indoor settings that health has already identified, you should be wearing a mask, in particular if it's a place of worship. We already know what the high-risk areas are. We know what the high-risk areas of transmission and the high-risk activities are, and we ask people to respond accordingly. Don't think you're immune. This can affect any of us. And we know from the cases, not just in the last few days, but previously, how absolutely contagious this virus is, how absolutely essential it is for us to get on top of it. And because health still doesn't know yet what the intermediary cases were, where the source of the spread in the community is, we have to be as vigilant as ever. The Deputy Premier will now make some comments about regional New South Wales. Dr. Chant will give her daily health update, and then Minister Hazzard will speak specifically about the Northern Beaches and also the importance of keeping good records. Thank you.
Well, thank you, Premier. And today, look, the message to and for regional New South Wales is one of calmness. There is no doubt that there is anxiety in the regions as people flock to the regions for their Christmas break, and we encourage that. But we already have in place some restrictions that minimise the risk to regional New South Wales. That is, of course, if you're from the Northern Beaches, you cannot travel to the regions. A message for those that are living in the outer metro area of Sydney: be mature, be understanding that you could cause some level of risk and anxiety in the region. So if you've got any symptoms, please get tested, change your travel plans, and maybe not visit regional New South Wales right now until we get on top of this issue. For those that are already in regional and rural New South Wales, and there'll be many from the Northern Beaches are already in the regions, we're asking you to self-isolate. Again, take responsibility. Our health system in the regions can manage this. But what we don't want is it to be overwhelmed, and that's why everyone must take responsibility. The regions are looking forward to Christmas, looking forward to being hospitable and welcoming people to the regions, especially post the year that we've had in the bushfires last year. But at the same time, we want people just to take a level of responsibility. So the message today is, we're calm, and you can see the numbers today that what the health experts have done, the contact tracers, what New South Wales Health and the leadership of Brad Hazzard as the Health Minister and Kerry Chant, the Chief Medical Officer, is that we are on top of this. But the truth is, we still have to take responsibility. And that is my message to the regions today. No need to panic. We're putting in place all those levels of restrictions in Sydney to minimise any impact to the regions. More importantly, the message is for personal responsibility. If you're not feeling well, get checked before you travel to the regions.
Thank you. As the Premier indicated, there's 83 cases linked to the Avalon cluster, and there were 15 cases reported overnight. I think I'd just like to clarify that when we talk about community transmission, we make the distinction between those cases that are directly linked to cases and when they're unlinked. And I think we've had that experience throughout our COVID response. In terms of the cases, clearly there is evidence of community transmission in the Northern Beaches area, and hence that's why it is critical that we ask everyone to adhere to the directions that the Minister has put in place, and to only leave home for those essential reasons, and reminding people that visitors into that area or people can only enter the Northern Beaches for the essential reasons as well. We're also indicating that the direction applies to people that may have left the Northern Beaches after the 10th. So if you have left the Northern Beaches areas, local government area, since the 10th, it is critical that you follow the directions as if you were still residing in the Northern Beaches. So in effect, self-isolating and really not leaving the house except for essential reasons. We're also asking everyone to be incredibly vigilant and present for testing, and I want to acknowledge the good work of the Northern Beaches community in coming out for testing in droves. I appreciate that they have experienced some delays. We are working as hard as possible, but the test turnaround times to reassure the community are still holding up, and the majority of people are getting those tests well within the 24-hour period. In terms of the concerns, as the Premier indicated, we have yet to find the source of the infection and the route that has led to the seeding event that we believe occurred around that 11th of December at the RSL and was amplified by attendance at the Avalon Bolo and other sites within. Amplification occurred in other settings within that vicinity on the Northern Beaches. But we also have known that people have travelled into the Northern Beaches and attended some of those venues. So we know that some people within the Northern Beaches also work outside, and we have had a number of clusters that have arisen outside, all linked. Can I stress, all linked to the Avalon cluster at this point? But what we want to do is make sure that there is no further spread from those clusters outwards. So in relation to the Turramurra salon for hair, we have 5 cases linked to that hair salon, and people who attended any time between Tuesday the 15th of December and Friday the 18th of December are close contacts and need to test and self-isolate for 14 days since they were last there. We believe we have contacted the vast majority of people, but some people had incorrect or illegible contact details. So what I'm asking is that friends and relatives of people that know people go to the Turramurra salon for hair, please prompt your friends and relatives to check whether they attended on those days and follow the health advice, get tested immediately, and please isolate if you're that 1 or 2 people that we haven't managed to track down at the moment. In relation to the Rose of Australia Hotel at Erskineville, this was previously identified as a close contact venue on our website. What I can say is that we've had another case linked to that venue, and so that gives added urgency and an added message to reinforce that everyone at that venue is in fact a close contact, And so if you have been there on the evening of the 15th of December, between 7 to 9 p.m, you are a close contact. You need to get immediately tested and self-isolate. And can I thank all those who have already adhered to that or have responded to the message. Again, we are aware that the records were incomplete in the fact that we know that some people have heard through friends and family and have been contacted through those means. Again, I stress, if you know that you've been there with a party, just check that everyone is aware of those details. Please help us and assist us if there are any minor gaps in the data from that hotel. I would also like to just update in relation to aged care. Aged care facilities are considered particularly vulnerable, so we are asking that visitors do not, that aged care facilities for the next while till Wednesday do not have any visitors. We'll update our advice, but this is to again make sure we don't have any inadvertent seeding events in those into those nursing homes, which are particularly vulnerable, until we're sure about the extent and scope of the outbreak. Again, whilst we have a strong focus on the northern beaches, it is important that we have no complacency across the Greater Sydney region, but in particular that complacency must not exist across the whole of New South Wales. So please, I urge, if you've got the mildest of symptoms, please come forward for testing and self-isolate until you have a negative result. The website is going to be continually updated. Every time we interview cases or we double check cases, the information on the website changes. Also, as we have new cases, it may change our view of a venue. So we may have thought that transmission might not have occurred at a venue, but then, as I said, monitor that website for changed information. And thank you for playing your part in helping us bring this under control. Thank you.
Thank you, Dr. Chan. Look, I'd like to start by just thanking the Northern Beaches community, of which I am part. The fact that there are still masses of people coming out to be tested is just testament to the fact that Northern Beaches community really does get the fact that we need to find out exactly what this virus is doing and make sure that we cut off the chains of transmission. So thank you to all of the Northern Beaches community. I also remind Northern Beaches community that at the present time they should be staying at home unless they have one of the four reasons, and that is essentially if they have to go to work, they can't do their work from home, or if they have to go out for education, or if they have to go out for health or other compassionate reasons, or indeed exercise. So essentially, and I think from what I can see, most of the community are already doing that. Most of the Northern Beaches villages are looking more like ghost towns at the moment. There's very few people out on the streets, and I want to thank them for that. It really will make a difference to our health tracing team to have you just complying with the orders. I'd just like to also point out that new health orders were signed yesterday, particularly for the Greater Sydney region, which requires that if you do go out and you're going to somebody else's home, there should be no more than 10 visitors in anybody else's home for the time being. We've also required that where it was one person per 2 square metres, it's effectively now one person per 4 square metres, or a maximum of 300 at various hospitality venues and churches. Very important, Dr. Chant has told us 1,000 times that aerosols, or what comes out of our mouth, is particularly difficult, particularly dangerous if we're singing. And of course, that now has been restricted, singing and dancing. As of midnight last night, any dancing is restricted to just the bridal couple, maximum 20 people at any wedding. But otherwise, no dancing. And singing, if you are in a church service or somewhere similar, you've got singing, there can only be 5 singers, that's it. And they have to be at least 1.5 metres apart from each other and 5 metres away from any other people that might be there. I want to address the QR code issue. We have world-class tracers in health, but they can only do their job if we as a community give them the information they need if and when it is needed. Now, what we are finding is that some of the visitors to various venues still think that it's funny to be putting in there that you're Donald Duck or Mickey Mouse or a false phone number. That must stop. This is a worldwide COVID pandemic, and thinking it's smart to call yourself Donald Duck or Mickey Mouse is about as stupid as it gets. So that must cease. Secondly, businesses who do have QR codes and are using other than the Service New South Wales providers really need to equip themselves now with the knowledge of who they call in the event that they get a call from health. They need to be able to tell our health tracers clearly what the data is that their supplier, their provider, is actually holding. So for the vast array of private providers, a message to them is to make sure that each of your facilities where you have a QR code being used knows how to contact you to get the relevant data to give over to health very quickly. We need to understand this until there's a vaccine. No matter what happens now, the risks will remain. So we need to have that understanding both from the people who are going in there, but also the proprietors of the businesses, that they must understand how to gather that data together that they may already have and to pass it on to our gold standard, if not, as I've said before, diamond standard health tracers, and they will keep us safe if you actually help us to keep you safe. Thank you.
Minister, you've been talking for a while about the Service New South Wales QR code and how the government was considering making the Service New South Wales platform mandatory. How many warnings do businesses need to get their systems up to scratch, or for you to implement the Service New South Wales system across the board?
Look, I think the answer to that is, as we've said many times, this whole journey has been one of collaboration and taking the community with us. Our community in New South Wales has responded in the darkest of times. This is not the darkest of times, it's a challenging time. So what we're actually just doing is reminding people that, particularly the businesses, that just think about that extra step. Particularly outside the Northern Beaches, there's not too many businesses operating at the moment on the Northern Beaches, but outside, we do need people to think about it and to make sure that they do what's necessary. And we're quite sure that if they just take that on board and realise, and I think it's just a case of not realising that they may not have ready access to that information that we're asking for. So it's not a punitive approach. We've never done that unnecessarily. We don't see that as necessary at this point, but constant review, constantly are reviewing the whole circumstances. It is a very challenging time. It's a 1 in 100 year time. So,
but why is it not necessary?
Well, I think I just answered that. Yeah.
But you didn't answer it because why is it not necessary now? If you're saying that the information isn't there that you need for contact tracers to do their job, why haven't we already made this mandatory?
It's mandatory to have a QR code.
But why not the Service New South Wales one?
Because there are many people who have actually set up structures that work very well, and we're going to work with our community, not actually be punitive as you're suggesting.
It sounds like they're not working.
We're on track to celebrate Christmas without being all in lockdown. Where are we? I don't know. Tomorrow's the important day.
Yeah.
But the way we're tracking, how's it looking?
Look, unfortunately, one day's results doesn't tell us it's a trend. I mean, obviously, we've halved the number of cases overnight, but in a pandemic, there is a level of volatility. So we'll be closely monitoring what happens, obviously, to 8 p.m. tonight, and we'll be making a final call on Wednesday morning.
But
so
this obviously, you're pretty pleased with what we've gone from 30 to 15 with all those tests.
As I said, I'm extremely pleased we've had a record number of tests. To have more than 38,000 people come forward in a 24-hour period gives us enormous confidence that the number of cases that have been identified is a realistic position given the number of people that have come forward to get tested. However, this is an ongoing and evolving situation. We know how contagious the virus is. There could be very well developments in the next few hours which cause us again to go back to the number of cases we've seen in the last few days. So I appreciate how frustrating it is, and I'd love to be able to tell everybody today what Christmas might look like in New South Wales or the Northern Beaches, but we're not in a position to do that yet, and I appreciate the community has been extremely patient But I also appreciate, I think the community understands our position. We want to make sure we keep people healthy. We also want to make sure we reduce that social isolation and don't allow people to have adverse mental health consequences because of what Christmas or New Year's might look like for them.
Premier, for nursing homes, Premier.
It's been fantastic.
I'm sorry?
In terms of progress, it's been fantastic. You've got 4 factors. You've got the record tests. You've got the fact that it is halved from yesterday. You've got the fact that it's still the same cluster, and you've got the geographical isolation of the northern beaches. I mean, this is about as good a result today as you'd want.
Well, look, there's no doubt that we're pleased with what we've seen today. But one thing I've learned during the pandemic is that things are very volatile and they can move very quickly. And I wouldn't want to really put at risk the wonderful progress we've made by a knee-jerk reaction today. We really need to monitor hour by hour what's happening. We need to monitor and make a final call on Wednesday as to what Christmas and the next few days will look like. And I appreciate people have plans in place. I mean, my family's no different to anybody else's. I think we all empathise with each other. We all are desperate to have a Christmas that we hope we will. But I think all of us also understand that this year has been like no other. And all of us have had to make sacrifices and consider what we do. That is the one good thing. We're all in this together. We all appreciate what each other is going through. But having said that, I'm pleased with what we've seen overnight. But again, it's volatile. Things go up and down. If we see the trend continue in the next few days, obviously that will give us more confidence to look at what Thursday and Friday. We know that for many cultures and for many people, Christmas Eve is as important as Christmas Day. So we are considering all of that in our decision making, but we also need to get it right. And to date, I'm very pleased with the balance we have in New South Wales. I appreciate other state premiers have had a bit to comment about what we're doing in New South Wales, but I'm confident the strategies we have in place are working. And I'm also confident in the people of our great state. We've been used to doing the right thing for a long time, and the results, I think, are demonstrating that. But it is very volatile, so we need to make sure we leave it till the last possible moment before we make a decision.
Premier, it's been reported that patient 0 is believed to be a return traveller from Los Angeles. Can you confirm that information?
No, well, we can't. What we've been able to do, which Health has said, is they've identified the strain or the person who had that strain on the 1st of December. But what is still in question is the intermediaries. How did it get from that person in quarantine to the community? And Health has yet to determine that. So can I please ask everybody not to speculate, because if we had that information, we would tell you. Please know that in New South Wales, we give you real-time information on venues, because the more information you have as our citizens, the more action you can take to keep everybody safe. So as soon as we have that information, we'll make it available. But I believe and understand there have been a lot of rumours and speculation, but let's please stick to the facts. Dr. Chant and the health experts will give us those facts as soon as we have them. But in the meantime, can I again commend the contact tracers? The work they've done in a very short amount of time has been unbelievable. But that's why it's so important for all venues to have their QR codes in place, their systems in place. Places of worship should also have QR codes, be encouraged to have QR codes, or at least really good record keeping. So whether you're an organisation or whether, obviously, though there are certain organisations which have to have mandatory QR codes and businesses, but we're asking everybody to make sure, do not open your premises, do not let anyone physically into your premises. Obviously the northern beaches, you can't do that anyway, but outside the northern beaches, do not let anyone in your front door unless you have a good record of who's coming in at what time and what time they left, because otherwise Health can't do their job, and otherwise all of us risk Christmas and the New Year period if we don't all stick together and do the right thing. But to date, the hard work everybody has put in, whether it's our experts in health or the police with compliance or Service New South Wales or our tourism operators in the regions, everybody is doing their bit, and we need to continue on this track to have the best chance of having a better outcome.
Premier, if we know where the strain is from,
outside of the northern beaches, how are the testing rates, and are they making you confident that there's no seeding, or that at this stage we don't think there is seeding? And separately on Illawarra shoulder why is that included in the restrictions?
Yeah, well, I'll answer the first part of the question and get Dr. Chant to finish the answer off. But clearly we're pleased with the testing rates across the state, across Greater Sydney in particular as well. But in a pandemic, you're never confident you've 100% got every strain or every case. I mean, that would be a dishonest way to answer the question. We are never confident you've caught everything, because when you don't know the intermediaries, when you don't know exactly every single person that was at a venue at a time, because of record keeping, you can't give that assurance. But what we can do is confidently state that every single person who's been identified as positive in the last few days has been directly linked to the Avalon cluster, and that's the way we want to keep it. And that's why I'm so grateful that people in Greater Sydney, people outside the Northern Beaches, have taken the advice of minimising non-essential travel, non-essential activity. We appreciate lots of people have had to cancel events, lots of people have had to change the way they're doing things. If you're going shopping outside of the Northern Beaches, please also make sure you're wearing a mask in those indoor settings. If you're going to a place of worship outside the Northern Beaches, make sure you're wearing a mask. Make sure you get tested with the mildest of symptoms. The last thing any of us want to do, because we're allowed to have 10 people into our homes, is give the virus to those most closest to us. I mean, there are horrible situations overseas where entire families have been affected. Generations of families have been affected because one person in the room, in the house, gave it to everybody else with dire consequences. Please, let's not have that situation here. By doing the right thing, if someone has a symptom in your close contacts, in your family members, please ask them to stay home and not come and celebrate or come to your home, because that will jeopardise everybody else as well. So we just ask everybody to stay vigilant, and I'll ask Dr. Chant to comment about those geographic issues.
So clearly we are monitoring testing outside the Northern Beaches, because as we've got quite tight restrictions on residents of Northern Beaches, it is really our focus from public health response is to ensure that we're not missing undetected transmission in regions and areas outside of the Northern Beaches. We're particularly focused on those where we know that positive cases have been, and around those venues that we have identified on our website. The advice we've had is that testing numbers have been higher in all other areas, and we're waiting for the data to come in and be cut, and we will closely monitor that levels. But the preliminary information we have is that we have seen testing surge across the state. And can I thank every one of the people that have come forward for testing.
Yep.
Now, testing alone is one of the critical elements we need. So anyone with symptoms, please get tested. And I'm particularly stressing for that statewide. Don't just think this is a Northern Beaches issue. We need everyone to help us detect any undiagnosed transmission. Also, we're supplementing that by our sewage surveillance. And again, I'm asking people not to rely totally on the sewage surveillance, but it is an important adjunct. And we are monitoring that closely, particularly across regional areas and across metropolitan Sydney, outside this, obviously where we've got these active cases. So the things that we're looking for over the next couple of days is the number of cases that we're reporting that have already been isolating for the full period of their infectiousness. And that's a measure of the effectiveness of our intervention. So if we are getting cases and all of those cases have not been out in the community in their infectious period, it means that they then cannot be on spreading the disease, and the disease risk has been stopped.
Dr. Chan,
Do you know the 15 that they've been in isolation?
A number of them, so please.
Any idea how many of the 15?
I'll be able to get the exact number of that, but as I said, sometimes it's around partially isolated for one day, and this because we recall that we take them from 48 hours prior to a positive test if they were asymptomatic or symptom onset. And so I'll get you that data, but the anecdotal feedback I've had from the staff who are collating that information, because it is important for me to review that every day, is that we have seen a number of the cases be isolated for their infectious period.
What's like, Dr. Chant?
Just to clarify, you spoke about the Turramurra Hair Salon and also the pub in Erskineville. Are they the only two places where you've seen, subsequent cases from the Avalon cluster?
We have seen a workplace transmission event in a workplace in the CBD. Again, linked by someone who'd unknowingly brought that into that workplace. Can I also stress that it is really critical that we do not call out people in this outbreak or send myths around who spread it to whom and who's contributed and who's seeded it. It's really counterproductive, because at the moment, people need to come forward for testing. And we need to thank every single person who has taken the step of coming through for testing, because we know that not everyone with respiratory symptoms is coming forward for testing, and we've known that all along. So can we just also acknowledge the important role that people are doing in coming forward for testing?
Dr. Trump, we know that this person...
Talk us through in terms of what you're going to be looking at over the next 2 days before you make the announcement on Wednesday of what we can and can't do. Like, what's your assessment of
Okay,
what you
so
need?
the key things that we're looking for is whether we've got any evidence of community spread outside the northern beaches. So we would expect that within the local area where there's these many venues, that there would have been some community spread within the northern beaches area. What we're concerned about is, yes, we've had seeding events where people have gone from being exposed in the northern beaches and gone back to other parts of the CBD, southeastern Sydney, the broader northern Sydney area, Penrith, I think where all those venues are give an indication of where people have resided. So what we're interested in is making sure that we don't see any further transmission that is not linked exactly to the Avalon cluster.
Just to clarify though, the woman who is from the United States who's in hotel quarantine, there's actually not that many options for it to have got from this person out into the community. So could we not, from a logistics standpoint, look at aircrew on her particular flight and the hotel quarantine staff?
Can I just say, for one thing, yes, we are looking at that person, because that person, so part of the investigation is to look at, yes, we've got these sequences from the Avalon cluster, do they match anyone else? It's not a perfect match with that returned traveller, but it's close. So it does raise the possibility about whether there could have been a transmission event from that person inadvertently to someone else who then went and seeded this event. So we're pursuing that line of inquiry, but we don't know, this strain may well be present in other people that have come from the United States, so our investigations are broad spread. So we actually have, to your point, gone back and reviewed all the CCTV footage around this individual. We've tested cleaners at the hotel, we've tested people that transported her when the person went to a health facility. We've looked at anyone who may have come in contact with her, even if they were wearing PPE, if it was longer than what we would normally expect, taking a very cautious approach in terms of trying to find that link in. We're also looking at flight crew, anyone else who may have returned from overseas, and as you know, we do that day 2 and day 12 testing. Meanwhile, the lab is also testing all of the isolates from any returned travellers to give us an idea of the prevalence of this strain, and also we are working with all of the international flight crew to get a sense of whether any flight crew who attended today was in the country in the relevant time period. So there is an extensive investigation going on behind the scenes. It is pivotal to us understanding the public health risk around how this transmission event occurred, but I think it's appropriate that we do that investigation, come to some finding before we speculate as to the source of it.
Dr. Chan, you can't close down all sites of transmission, or you can't shut down all the potential chains of transmission until you work out how the virus leaked out of quarantine into Avalon, can you?
So the issue is that the only thing that gives us comfort is time, and that's why the community plays such an important role. So for instance, if a period of time passes and we don't see additional cases in the community, and that requires those high testing rates, if we don't get our sewage surveillance pinging to show us that we're missing undetected outbreaks, that gives us confidence that for whatever reason this event is a seeding event in Northern Beaches and it hasn't extended beyond. At this point we don't know that to be the case, and that's why I am pleading with every member of the community to do your part, and even with the most minimal symptoms, please go forward and get tested.
Dr. Chan,
What was the flight that she was on?
Question at a time, please.
Dr. Chan, your current advice on masks is that there's no reason, at least Premier, you said there's no reason people should not be wearing masks. But currently, we're just relying on the goodwill of people in those critical venues like indoor venues and public transport. Is it not safer just to mandate the use of masks, given we've already got public health orders in place?
So we are considering at all times additional measures that need to be in place. Can I just say the feedback I've had from the Northern Beaches community is that everyone is being very compliant with the requirements around wearing masks indoors. Of course, I would continue to stress that, and we will look at any additional requirements around that. Our messaging around masks has been pretty consistent, and I've also noticed we will be monitoring the uptake of mask wearing. The sites that we're particularly concerned about is indoor venues. So when you're going into an indoor venue, please wear a mask. This will just help us gain greater control in the case that there is an unrecognised person out there that has the virus.
Dr. Chan, how many people are sick in that cluster?
Do you release genomic sequencing reports like other states have done?
Yes, I mean we release, if you look at our weekly epidemiological report, I think we give you quite detailed data on which viruses are linked to which viruses. Can I just say at the moment, the sequencing shows that the genetic sequences for the Avalon cases that have been sequenced are all similar. At the moment, to be perfectly frank, our priority for the sequences, we need to give the lab a bit of a break. They've been working 24/7. Our priority for sequencing now will be any cases that are not outside the Northern Beaches that are not linked directly to the cluster, because that's going to be the most important.
What flight was that returned traveller on, and have you been able to identify and test all of the flight crew that was on that flight? The returning traveller.
So all of the people on the flight went into a quarantine or isolation arrangements. We have made contact with the relevant company and advised that all of them were complying with self-isolation requirements, and we're following up any testing results.
There's confusion over the Illawarra and Shoalhaven.
So the issue is that the restrictions are in place for the greater metropolitan Sydney, and I think everyone would realise the connectivity of Wollongong and Central Coast and Nepean Blue Mountains to that greater fringe. It is where the vast majority of the community live. It is where we have the most dense populations and hence the larger venues, and so those capacity caps moving to the 1 per 4. The purpose of these restrictions are to decrease the risk of a seeding event. So if someone in those premises is doing what we're asking people to do, wear a mask, it's more not packed, they're not moving around in those venues, they're not dancing and singing. Can I just say, my concern is around loud noise, talking loudly, singing. So we just know the more you have to shout or talk or raise your voice, it just increases the amount of aerosols in a room. If it's poorly ventilated, then that really poses a great COVID risk. So we are asking, another thing that venues can do is really look at how you can keep them open to the air.
Last few questions, please.
Just from an epidemiological point of view, and I'll probably follow up with Mr. Hazard on this one too in terms of policy. Does it make sense for airlines to be using flight attendants based in the Northern Beaches, those who are actually in the hot zone? Are they essential services, or do you think airlines like Qantas should avoid those sorts of employees and seek elsewhere in terms of the spread of this? Follow-up question.
Look, we can follow up with Qantas in terms of their operational arrangements for pilots in the in that area. They're prohibited from going to work unless they can undertake that work remotely. And I suppose
I'm asking you, you're expert.
I mean, I would. Does it make sense
that flight attendants from the Northern Beaches should be called to work?
I would prefer that arrangements are made to keep people in the Northern Beaches and that alternate arrangements are put in place.
Premier.
And the same for you, Mr. Hazard, in terms of that. From a policy point of view.
Premier, can I ask you a similar question?
Is there any link between the cleaner, the driver of the crew, and the person in hotel quarantine?
No,
that strain.
They're three distinct strains, so they're not They're distinct. They're not in any way linked. Obviously, that was a clear question we had at the beginning. They're very clear, distinct strains.
Dr. Chant, just a really quick one, for Dr. Chant. Of the 70 or so new cases we have seen over the past week, how many of them are sick? Are any of them in hospital?
So I'll have to get an update, but I wasn't aware that anyone's been admitted to ICU, and I will just have to update it, but I'm not aware of hospitalisation, but we need to check daily if the situation changes. I will also remind the community that often the second week of a COVID illness symptoms become more severe, and people can experience complications in the second week. And so it is important that we support and monitor, and that the health needs of the people diagnosed with COVID are addressed, and we should not be complacent with the impact that this virus can have on individuals and communities.
Premier, just in relation to some changes that are coming in tomorrow, that changes to the public health orders, Premier, why are airline crew flying in today still able to come into New South Wales and not be tested before going to accommodation? And secondly, in the new strengthened rules, New South Wales resident flight crew are allowed to self-isolate at their home. Is that right?
Look, I'll get Dr. Chant to cover off on that, but can I make this very clear that New South Wales prides itself on making sure we mitigate the risk at every part of this pandemic. And as we've explained, there are new arrangements coming into place from tomorrow, but Dr. Chant also has authority in certain circumstances to obligate for certain things to occur, and I'll ask her to outline.
I was asking a political question about why the health orders have been written the way that they are.
There's nothing political about this. This is all about the health advice.
So in terms of the testing question, those individuals will be able to self-isolate if they undergo testing. So if they decline testing, they will be refused the ability to self-isolate. In terms of the other flight crew coming in, the majority of the flight crew are flying in and flying out within often 24 to 48 hours. So they're coming, doing their mandatory rest period, and then flying out. So the issue associated with testing is that what's most important is that we manage the end-to-end process. So we manage all of the points from their transfer, so that they're not coming into contact with anyone in a way that would pose a risk. It's important that we treat all international people that are returning from overseas and assume they have COVID in the way we manage them. And so, yes, testing can be a supplementary control, but what's most important is that we manage the end-to-end process so they do not come in. So it's really mainly about infection prevention and control. Making sure they're wearing the mask, making sure they're doing the hand washing, making sure they get on the transport to a hotel, that they get to their rooms and they maintain the rooms and then just depart.
Given that we're treating everyone the same as if they have...
So from Tuesday, from tomorrow, they will be in police managed hotels.
Except for people who live in New
except
South
for the
Wales.
ones that live in New South Wales, and they will be allowed to self-isolate at home, but they are required to have a COVID test, and they will be followed up.
Given it's based on your health advice, in your expert health opinion, would it be safer...
Sorry.
Yes, sorry.
Given these rules... Sorry, Dr. Chant.
Sorry, it's just my mother's aged care facility. Return that call. I'm not a negligent daughter. I will ring.
Given these rules are based on your health advice, Dr. Chant, in your expert health opinion, would it be safer for the community to have returning New South Wales resident air crew in police-managed quarantine facilities, not self-isolating at home?
So look, there are a number of dimensions to the risk, and I think we're never balancing one risk over another. What we also need to understand is that flight crew are often isolating forever, and so it is about the environment in which they're isolating and their mental health, because there are also risks if we have flight crew or pilots that are also fatigued or suffering mental health issues from prolonged periods of isolation. These are all balancing risks. the issue about requiring them to be tested significantly mitigates the risk. We are also working to have them followed up. There are some particular issues that we can't, contact them they have to have a sleep before they fly out. So we are going to be also monitoring them closely in the homes as well as an additional precaution.
Would it be
Thank
safe
you,
for the community?
everybody.
Would it be safe for the
Last
community?
one, please.
You're a bit concerned about the strain out of the UK.
Yes.
And so obviously you'll be watching that. We've obviously got return travellers coming from the UK. Do we need to react?
So,
should we stop people coming in from the UK?
Okay, so to let you know that we have had, I've been advised, and this is because all the sequencing may not have been completed on all returned overseas travellers. Obviously, that's not our total priority when we're dealing with an outbreak. But to date, I'm advised that we have had a couple of UK returned travellers with the particular mutations you're referring to. Can I be very clear that the Avalon cluster strain does not have those mutations? So, but the key point, regardless, is that we need to treat all people with that end-to-end process of making sure they're not coming in contact and there is not a risk of exposure to any residents in New South Wales.
Thank you, everybody. Dr. Chan needs to make a phone call.
Very quickly,
Premier,
may I ask you,
ask
we've taken 88,000 people in our hotel quarantine, and the next closest is Queensland on 26,000 from memory. There's been a lot of advice given to you from these other premiers in the last day or so. One, would New South Wales like them to take a greater amount while we deal with this, to take the pressure off this state? And two, do you have any statement for them in relation to that?
Firstly, I'll say that I think it's been for some months that I've been arguing that New South Wales is doing more than its fair share, and we appreciate we need to get returning Aussies home, but as I've also said, there's a risk to every person you bring back home. But we acknowledge that, and all I'm saying to the other states is, play your part, lift your game. And in relation to the responses to the cases in New South Wales, I'll just make this point. I mean, the various premiers have made various decisions about borders, but I ask people to think about things compassionately and base it on the facts. For example, when we closed, and the only time New South Wales has closed a border to anybody was Victoria, their case numbers were more than 140 before we took that decision, and that was subsequently 120, and then went it back up to 180. So we were in that zone of when we decided, in cooperation with the Victorian Premier and the Prime Minister, to make that move. And I use that fact to put things into perspective. Yes, of course I'm concerned by what's happening in New South Wales, but every response has to be proportionate to the risk. And all I'm saying to colleagues around the country is please think about the heartbreak, and please think about the facts when you're making these decisions, because it impacts so many people. It impacts not just people in New South Wales, but people in your home states that may not have been reunited with family or friends or significant others for a long period of time. So all I say is let's all of us make our decision on the facts. New South Wales strategy has been consistent, and we'll continue to hold our line because our people have responded, our citizens have responded very favourably to the way in which we've put things in place. We've been respectful to each other. Our citizens have been respectful to the decisions we've had to make, and we've respected the position they're in. And I just ask colleagues from other states to consider that. It is a very emotional time of the year. We've all had a very difficult year. And please make sure that your response is proportionate to what's happening. And yes, whilst it's volatile, we're down to 15 cases, and I hope that trend continues. And I hope we maintain all the cases that emerge in the next few days to the Northern Beaches. Of course, we don't have that assurance. But until the facts are to the contrary, please make decisions based on the facts. That's all we ask for in New South Wales. And we also say to the rest of the nation, we're doing our bit in terms of bringing home your travellers. 45% of people who come through are from other states. And when I get helpful advice from other premiers, my response is please consider the heavy load New South Wales has been lifting to bring back Aussies. And we ask every other state to do their bit proportionately as well.
How sad is the timing?
Have National Cabinet reconvened to discuss the relationships between the states, the response here?
Look, I don't think anything that any other state premier has said or done contradicts the position of National Cabinet. I mean, National Cabinet is given advice, National Cabinet is given guidelines, and then it's up to every state premier to make decisions based on that. That's why I'm pleading with them to consider the facts and to be compassionate and to look at the way in which we've responded when things have happened in their states. We responded, I believe, in a proportionate way, and I just ask other states to consider that as well. In the case of Victoria, they had over 140 cases before we actually made the decision, the difficult decision to close the border. And I just ask other states to consider that in their responses.
Premier, how sad is the timing of this, given that we've had a pretty good run for the past few months?
Sorry, I will make this the last question. Look, there's no doubt that it's unfortunate this has happened at this time of year, but we've always been on high alert knowing that you can't control what happens in a pandemic. What you can do, though, is control the response you have to the situation, and that's why we're trying to take a very balanced approach, make those difficult decisions we need to keep the community safe, but also appreciate the circumstances that are around this time of year as well. Thanks, everybody.
Thanks, everybody. Good job.
Oh, thank you.
Hello.